So we were interested to understand like what is actually happening in the field in terms of like the way collaborative governance is actually enacted. So we actually carried out 2 surveys, and we're trying to actually understand what are the main characteristics of this collective governance of Ontario Health Teams. And the survey specifically tried to capture the compositions of the different leadership groups, and also how they perceived the way they functioned within their collaborative networks. So our key findings for in terms of how the composition of these leadership groups was that they were relatively large. That is like most of them, with a median of 15 members going up to 65 members. Then there was also relatively stable, like more than 74% of them were actually had a turnover of 10%. Then most of them actually represented signature organizations, with very few representing specific minority groups like indigenous, francophones, or racialized groups. Now presenting about the how these groups were functioning. So the kinds of questions we wanted to understand is the decision-making processes that were involved, their level of commitments, how they actually monitored the implementation of the OHTs, and their perceptions on the effectiveness of their Ontario Health Teams. So in summary, we actually, what we noticed that most OHTs actually make decisions through by consensus, and that most acute care respondents were more likely to actually think that every other person has that they were had equal influence in the way decisions were made, and they also had more positive performance perceptions of the functioning of the OHTs in terms of like the level of commitment of themselves, how others were committed towards the OHT, and also in rating the overall effectiveness of the OHT.